If you're watching this, it's probably because something in your body has been hurting for a long time. A knee, a shoulder, a hip, your back, and you've started to accept that this is just how it's going to be from now on. I want to tell you something that took me years and my own injuries to fully understand. You are not healing. You are maintaining. Every treatment you've tried so far, the injections, the anti-inflammatories, the physical therapy, most of it was designed to quiet the pain, not to repair what's actually causing it. So the damage stays exactly where it is, and you manage it month after month, year after year. I'm Dr. D, and I built Operation Phoenix because I lived that exact cycle myself, and because there's another way to think about this that almost no one has explained to you. Give me the next few minutes and I'll show you what your body is actually capable of. Let me tell you how I got here, because it matters. I spent years in emergency and internal medicine. I served as a physician in the Army, and I've also been an athlete my whole life. And in between service and sport, my body took a beating. I had the injuries, I had the chronic pain. And so I did exactly what I was trained to do and exactly what every doctor told me to do. I took the anti-inflammatories, I got the steroid injections, and eventually I was told that surgery was the only real option left. And here's the part that changed everything for me. As a physician, I understood the science of how the body actually repairs itself at the cellular level, and I realized that almost everything we're doing to treat pain was quietly working against that repair. We were masking, turning off the warning light instead of fixing the engine. So I went looking for a better answer, not as a marketer or a salesperson, but as a doctor and a patient who refused to accept that decline was the only path forward. What I found became Operation Phoenix. Now, I want to teach you something, because once you understand this, you'll see your own situation completely differently. Your body already knows how to repair itself. When you cut your skin, it heals. When you break a bone, it knits back together. That same repair machinery exists for your joints, your tendons, your cartilage, the tissues that have been hurting you. So the real question isn't, why won't it heal? The real question is, what has been standing in the way of it healing? And this is where it gets uncomfortable, because part of the answer is the very thing that we've been told to reach for. Anti-inflammatory drugs and steroid injections that give you temporary relief. But relief and repair are not the same thing. Those same medications can actually suppress the natural repair process over time. So you feel a little better for a while, but the underlying tissue keeps degrading, and you end up needing more relief more often for a problem that's getting worse underneath. Pain, in that sense, isn't your enemy. Think of it as your body's alarm system, and when you only take something to silence the alarm, the problem that was warning you about is still there. It's still getting worse, while you simply stopped hearing about it. Roughly 70% of adults, 70%, over 50 are living with joint pain. Most of them have been handed the same two options: silence the alarm or cut it out with surgery. Now there's a third path, and it's built on helping your body do the one thing that it was always designed to do: repair. So let me show you what that third path actually is, and why the way we treat it is different from anything else you may have heard about. The approach is regenerative. It uses your body's own repair signals to help rebuild the tissue at the source rather than just numbing it. But here's what most people never get told. Not all of these treatments are the same, and these differences are everything. 3 things determine whether this actually works. First, you need enough of the right cells delivered at the right dose and concentration. Too little, you're wasting your time and money. Second, you want what are called exosomes, which act like messengers that amplify and direct the repair signal. Think of them as the force multiplier that tells your tissue what to do and how to do it. And then third, and this is the one I care about most, the source of the material matters enormously. A lot of clinics use cells that are taken from adults' own fat or bone marrow. The problem is, if you're 65, those are 65-year-old cells, and they age right along with you, and they carry that age along with them. What we use is different. It comes from developmentally young, age 0 source, perinatal tissue obtained at the time of a healthy, full-term birth with no harm to the mother or baby. It hasn't aged, it's naturally rich in the growth factors, collagen, and the very building blocks, the extracellular matrix, that tissue needs to rebuild. And just as important as the source is how it's handled. The material we use comes from carefully health screened donors, processed in an FDA-registered licensed tissue facility, kept in clean room conditions, using strict national tissue banking standards, and kept in cold storage from processing to the moment that it's used. That combination, a young, vital source, and rigorous standardized processing, is one of the biggest reasons some people get a real result and others don't. Now, understanding the science is one thing, but you're probably wondering what this is like to go through. And that's where our approach is genuinely different. First, precision matters. We use ultrasound guidance to place the material exactly where your body needs it. Not approximately, exactly at the site of the damage. For most people, this is a matter of 1 to 3 visits, not a hospital stay, not months in an operating room recovery. And here's what we're most proud of. We bring it to you. We deliver this in your own home across Florida in a calm and controlled environment where you're comfortable. Not a crowded waiting room or being rushed. This isn't a clinic experience. It's white glove care designed around you. As for what to expect, many people notice their first changes within 3 to 4 weeks. The more significant improvements tend to come over 60 to 90 days as the tissue genuinely rebuilds. Because remember, this is real repair, and real repair takes a little time. And for many, that improvement keeps building over 6 months and beyond. This is not a quick patch that wears off. It's your body doing the work that it was always meant to do with the right support. Let me speak directly to the things that you may be thinking of right now, because I've heard them from many people who are now some of my happiest patients. Because you're thinking, I just learned to live with this, and I understand that. But I'd like to ask you, living with this, or slowly giving up the things you love because of it? Those are not the same. Maybe you've been told that surgery is your only option. And for some conditions, surgery has its place, but it's permanent. It carries real risk. The recovery is long, and it comes with no guarantee that you'll get everything that you lost back. And once you've done it, you can't undo it. Exploring a regenerative option first costs you nothing but a conversation. Maybe you're worried it's too late for you, and you're too far along. In my experience, it's rarely true. And the only way to know is to actually have it evaluated. And yes, maybe you're thinking about the investment. I'll be honest with you, this is an investment in your body. But I'd ask you to weigh it against what you're already spending. The cortisone injections that wear off, the medications, the specialist visits, the things that you no longer do, the trips that you don't take, the life that has been quietly shrinking to fit around the pain. And when you look at it that way, the question isn't, can I afford to do this? It's, how much longer am I willing to pay for a problem that isn't getting better? And for those who want it, we do offer financing. So cost alone doesn't have to stand between you and your decision. So here's where you are. You truly have 2 paths in front of you. On the first path, nothing changes. You keep managing the pain the way you have been. The same relief that wears off, the same slow narrowing of what you're able to do, watching from the sidelines of your own life while damage continues. You already know exactly where that path leads because you're walking it. On the second path, you simply find out. You have an honest conversation with my care team, and you learn whether your body is a candidate to actually repair what's been holding you back so you can get back to the golf, the travel, the grandkids, the walk around the block without thinking about it, whatever your life means to you. That is the entire decision in front of you today. Keep maintaining or find out if you can heal. I built Operation Phoenix for people who choose to find out. So take the next step now. Click the button below or call my care team directly at 866-986-7749. They'll help you find out whether you're a candidate, answer every question you have, and guide you through everything from here. There's no pressure and no obligation, just the answers you've been looking for. You don't have to keep living around this pain. Let's find out what your body can still do.